What does informed consent for prazosin, otherwise known as mini press, look like? My name is Dr. Ruth Sutton. I'm a board certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I'm going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about prazosin, otherwise known as mini press. So this is actually a blood pressure medication. It's an alpha-1 adrenergic antagonist, and so it was originally developed as a blood pressure medication, but we've also found that it's really helpful in the treatment of trauma symptoms, specifically intrusive symptoms like nightmares and flashbacks, as well as hypervigilance. So it's actually only FDA approved for the treatment of blood pressure. However, it's used off-label for a number of other things. So in addition to nightmares, flashbacks from PTSD, it's also used to treat benign prostatic hypertrophy, Raynaud syndrome, as well as pheochromocytoma. But probably the most common off-label use you'll see is for the treatment of PTSD symptoms. So typically we recommend taking this at night to help with nightmares. However, I've also had cases where people have really intense intrusive symptoms during the day, and I've seen that there can be benefit from prescribing this during the day as well. Now, this medication certainly has mixed efficacy. I found that for some people, it makes a huge difference in terms of their symptoms, while for others, it's like a sugar pill. But I say that with the caveat that we usually start prescribing around 1 milligram, but some people can tolerate and actually need much higher dosages, like 10 milligrams or greater. That being said, because it's a blood pressure medication, it's important to always monitor blood pressure with this medication because depending on the individual, they may only be able to tolerate a certain dose before their blood pressure gets too low. So of course, the most common side effects are going to be associated with low blood pressure. So this is things like feeling dizzy, lightheaded. Sometimes it can cause headache, low energy, nausea. Sometimes there can be palpitations. And of course, because this is a blood pressure medication, if someone is on other blood pressure medications or they have a significant cardiac history, it's important to discuss with their primary care provider or cardiologist before starting this type of medication to make sure that it's safe for them. Other side effects can include things like weakness, increased sweating, and nervousness. More serious and less common side effects include things like priapism, which is a sustained erection that won't go away, irregular heartbeat, shortness of breath, and changes in mood like depression or hallucinations. Generally, I think that for those for whom this medication is effective, it can be a great option for their trauma symptoms, at least in the short term, to help them manage. I don't think we have a lot of data about tapering off of this type of medication, so if you've had an experience of getting off of it and want to share that, then please do so in the comments below. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put that in the comments. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings, and I want to be able to communicate directly with you all about those things. So if that's you, send me a DM with your email, and I'll see you in the next one.